Dr. Patade.
Good afternoon, everyone. Today I'll be talking on light, a novel way to treat chalazion. So chalazion, as we know, is an inflammatory lesion of the eyelid and caused by obstruction of meibomian and Zeiss gland. So the current management which we see in chalazion is usually asking the patients for a good lid hygiene, incision and curettage, or giving intralesional injection of steroids. So recent studies have shown that intense pulse light, when applied close to the lids, have reduced the symptoms of dry eyes due to the meibomian gland dysfunction. So it was therefore interesting to examine if the IPL could also be helpful in the management of chalazion. So our purpose was to see the efficacy of IPL for the treatment of chalazion. We had included the acute, the early, chronic and recurrent chalazion, and the only exclusion criteria was Fitzpatrick skin grade 6. And the treatment was 1 or more IPL sittings at an interval of 1 month. The device used was luminous M22 with a fluence of 10 to 12 joules per centimeter square. The pulse structure was triplets and the wavelength range was around 560 or 590 to 1200 nanometer, and the treatment area was cheeks below the lower eyelids and the nose. So this is how, this is the filter and the cool light guided thing from which the IPL is given to the patients. So the pre-IPL, we had these patients who had acute, recurrent and chronic chalazions, and there were many patients with no previous treatment. There were patients who had undergone incision and curettage, and there were patients who had only taken the lid hygiene. So there were 58 eyelids of 50 patients which we had considered for our study. 1 to 3 of IPL sessions were given. So in every session there were around 1 to 4 sittings, and 80% of the patients almost showed complete resolutions with 1 to 4 sittings, and 20% shows around partial resolution with multiple sittings, but only the 4 sittings were given maximum. And none of the patients showed with any other complications, and the early chalazion, the smaller ones needed only maximum 1 sitting for the complete resolution, and recurrent and the chronic ones required more sittings. So this is one of the patients which we had done the IPL treatment. On the left side what we can see is the patient with the pre-IPL, and on the right side is the patient with the post-IPL, showing the reduction in the chalazion. This is one more picture in which we have everted the lid of the patient and seen pre-IPL there were these multiple chalazions present, and post-IPL after 1 sitting there was reduction in the size of the chalazion. These are the other patients which we had done in the similar way, showing a promising result for the reduction in the size of chalazion. So to conclude with, I would like to tell that it is a safe and effective way of treating chalazion, especially if the patients are coming to us with recurrent chalazion and long-standing cases. And it is yet another one technique added to the armamentarium of treating chalazion, though the long-term results are yet to be studied. Thank you.
Do you consider your number of cases are small?
Yes, sir.
So you could have taken a...
Yes, sir. We need to take on more, because we initially were doing this for the dry eyes, patients who were presenting us with the meibomian gland dysfunction. But later
have you confirmed it through mammography, or have you confirmed it through mammography?
Yes, sir. They definitely had better this thing. The patients were also symptomatically very much better, and the need for lubricating eye drops was also reduced in those patients.
Apart from putting the scalpel onto the patient's eye, do you find any other advantage? Because if the underlying pathology is there, if the lid hygiene is poor, whether you do surgery or whether you take the patient for IPL, the problem will be recurrent, it will keep coming. So do you find actually on ground any advantage in this?
So yes, sir. So there were many patients who had, we had actually undertaken their incision and curettage like multiple times, and then they were like we don't want an intervention like that is
that part has
painful, yeah.
I've already said it. Apart from surgical intervention, do you find any other advantage?
The recurrence rate had reduced, sir, in the patients, and that was more, the patients were more comfortable also at the same time.
Quick question. Yes. How did you exclude the Fitzpatrick type 6?
So basically there were other studies, ma'am, in which they had excluded Fitzpatrick 5 and 6 both. because of the more melanocytes in that skin type.
Category.
But we in our center had tried for Fitzpatrick grade 5 because the initial studies were only done till 4, and so we thought we would go one step extra and we would go for Fitzpatrick 5. Fitzpatrick 6 was not included, and also there were no patients with Fitzpatrick grade 6 as such available at the center too.
Okay, thank you.
Yeah, thank you, ma'am.